Hey everyone, and welcome. Today we are diving into a really different way of looking at migraine relief. It's an approach that tries to look past just treating the symptoms to find what might be the actual root cause. So let's get right into it.
If you're someone who suffers from migraines, this question, it probably hits you right where you live. It is a condition that can feel completely, totally overwhelming. It just takes over your entire life.
And it is so much more than just a bad headache, right? It's this all-consuming, whole-body experience. The articles we reviewed really nail it. That intense, throbbing pain, the way you can't stand any light or sound, and that awful, persistent nausea that just grinds your entire life to a halt.
So yeah, it's obvious this is a serious, life-changing condition. But what do we usually do about it? And more importantly, where does that fall short?
For so many of us, the first thing we reach for is medication. And listen, that can definitely offer some relief in the moment, but it often feels like just a temporary fix, like a Band-Aid. A really key point from our sources is that these meds can have side effects, and the big one is, they don't actually get to the bottom of what's causing the migraine in the first place.
So what if the real problem isn't where we've been looking all along? This is where things get really fascinating, with this idea of a surprising spinal link.
Okay, get this. The central idea here is that the source of all that agony might not actually be in your head. Instead, the problem could be starting in your neck, what's technically called your cervical spine. And that leads us to this term, vertebral subluxation. I know it sounds super complicated, but it's actually pretty straightforward. It's just a condition where the little bones in your neck, the vertebrae, get knocked out of their proper alignment. And that little shift can kick off a whole chain reaction of problems. And this shows you that chain reaction perfectly. It can start with something as simple as stress, or even just bad posture, from sitting hunched over a computer all day. That causes those little bones in your neck to get misaligned. Then, that misalignment starts to irritate the nerves and muscles around it, which messes with the signals going to your brain, and then bam, a full-blown migraine is triggered. So if we understand that root cause, how does that change the solution? Well, that's where the chiropractic approach comes in. This slide just lays out the difference so clearly. You see the conventional way? It focuses on the head, usually with medication to mask the symptoms. But the chiropractic approach flips that. It shifts the focus to the neck and the spine. The whole goal isn't just to dull the pain, but to address that root cause, the misalignment, and aim for natural long-term relief.
And listen, this isn't just a hunch. The research we're pulling from shows that chiropractic adjustments can make a huge difference. We're talking about significantly reducing how often migraines hit, how bad they are, and how long they stick around. Some studies even suggest it can be as effective as some preventative drugs.
The treatment plan itself is really comprehensive. It's not just one thing. It starts with those chiropractic adjustments using a gentle, controlled force to get things back in alignment. But it also includes soft tissue therapy to loosen up all those tight muscles in your neck and shoulders that add to the problem. And then there's practical, everyday advice on posture and exercises to help you stay well in the long run.
Now, to make all of this feel a bit more real, the source material we looked at actually zooms in on a specific expert to show how this works in practice.
So the sources use Dr. Ven Korokov, a doctor of chiropractic from Spartanburg, as a kind of case study. He really specializes in this type of patient-first approach to dealing with headaches and migraines. When you look at the credentials highlighted in the sources, you see this powerful combination of a Doctor of Chiropractic degree, advanced certifications, and a ton of experience with really complex spinal issues. But the key thing is the focus goes beyond just treatment. It's about teaching patients how to prevent the problem from coming back. But credentials are one thing. What about real-world results? Well, the source includes powerful stories from patients. For instance, a patient named Robert Erickson said, "Dr. Korokov's unique medical background made all the difference. He provided me with the recovery solution I needed." That's a pretty powerful testament to this specific approach.
All right, I bet you have some questions bubbling up. Let's tackle a couple of the most common ones that the sources bring up.
First up, and this is the big one on a lot of people's minds, is this stuff safe?
The answer, from all the material, is a very clear yes. But, and this is super important, it has to be performed by a licensed doctor of chiropractic. When it is, it's considered a widely recognized, safe, non-invasive treatment. Okay, so it's safe. The next thing you're probably wondering is, how long is this going to take? How many times do I have to go?
And the honest answer here is, it really depends. It's totally personal. Some people feel relief almost right away, maybe after just 1 or 2 sessions.
But for others, especially if you've been dealing with this for years, it might require a more extensive, personalized plan.
So I think the crucial takeaway here, the big idea our sources keep circling back to, is this. It's about choosing to be proactive. It's about deciding to go after the root cause of the pain instead of just constantly trying to cover up the symptoms.
And that really leaves us with one last question to chew on. What if true wellness isn't about getting better at managing your pain? What if it's about finding a way to get rid of the cause altogether? Thanks so much for joining me today.